How does Medicare calculate the allowed amount? Have you ever wondered how Medicare determines what it will pay for your healthcare services? Understanding this process can help you manage your medical costs effectively. Let's break it down in simple terms. Medicare calculates the allowed amount as the maximum payment it will consider for a covered service. This amount is based on a fee schedule that reflects the Medicare-approved payment rate for each service or procedure. First, we have the Medicare Fee Schedule. This is a standardized list that assigns a payment rate to each service. The rate is determined by combining relative value units, which measure the resources needed to provide the service, with a conversion factor that translates those units into dollar amounts. Keep in mind that these rates may vary by geographic region due to differences in costs. Next, for services that do not have a national uniform rate, Medicare uses one of three methods to standardize the allowed amount. The first method uses the national rate directly when it is available. The second method constructs the allowed amount by adding core costs and adjustments while removing geographic and special program factors. The third method starts with the claim allowed amount and removes regional adjustments and unrelated payments to arrive at a standardized allowed amount. Another important factor is the adjustment for provider participation. Providers who do not participate in Medicare may have different allowed amounts. For instance, non-participating providers have a limiting charge, which caps what they can charge patients above the Medicare-approved amount. When Medicare is the secondary payer, the calculation involves comparing the Medicare fee schedule amount, the primary payer's allowable charge, and the actual payments made by the primary payer. Medicare will pay the lowest of these differences up to its allowed amount. Typically, Medicare pays 80% of the allowed amount for covered services. This leaves the remaining 20% as the patient's coinsurance unless the patient has supplemental coverage. In practical terms, the allowed amount sets a ceiling on what Medicare will pay for a service. This helps both providers and patients understand payment limits. During medical bill review and healthcare cost management, knowing the Medicare allowed amount is essential. It helps identify overcharges and ensures that billing aligns with Medicare rules. Providers must write off any charges that exceed the allowed amount plus patient coinsurance. This prevents balance billing beyond what Medicare allows. This calculation process ensures that Medicare controls costs while fairly reimbursing providers based on standardized measures of service value. Understanding how the allowed amount is calculated can empower you to manage your healthcare costs more effectively.